About half of the world's population doesn't take in enough vitamin D, and low levels of vitamin D have been shown to be linked to increased risk for diabetes. This video is going to break down how vitamin D is related to diabetes and whether or not vitamin D supplementation with or without exercise impacts diabetes risk factors. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise helps prevent and slow the progression of diabetes. Vitamin D is related to several different aspects of health, and it may play a role in diabetes prevention and treatment. North Americans tend to have some of the highest levels of vitamin D compared to other areas of the world, and part of this might be due to how we fortify different types of foods with vitamin D, like milk, certain cereals, and juice. Our main sources of vitamin D comes from the sunlight, more specifically ultraviolet B rays, and we get about 80% of what we need from the sunlight. Other sources mainly come from animal sources like wild salmon, tuna, mackerel, trout, and different types of fish liver oil. Low levels of vitamin D are linked to increased risk of developing insulin resistance in children and adults, and it's also linked to a higher risk of developing type 2 diabetes. Let's get into how vitamin D is related to diabetes. Vitamin D has several different functions related to diabetes. The first is through its contribution to insulin secretion in the pancreas. Now, insulin is a very important hormone that helps to move glucose that's in the blood into different tissues, and so that's what helps to lower blood sugar or blood glucose. Now, the pancreas contains what are called beta cells, and it's the beta cells that actually secrete the insulin, and vitamin D helps to make sure that these beta cells are functioning properly, which ultimately leads to better glucose management in the body. Another role that vitamin D plays in our body is that it helps to improve insulin sensitivity. In other words, it helps the cells in our body better respond to insulin. In type 2 diabetes, one of the main characteristics is the cells in our body, they have real difficulty responding to insulin, and this is what causes increases in blood glucose. So vitamin D helps to promote better glucose management through increasing insulin sensitivity. The third way that vitamin D may benefit diabetes is through reducing inflammation related to insulin resistance. Type 2 diabetes is characterized by inflammation all throughout the body, and vitamin D may help to reduce that inflammation and improve metabolism. If you have any experience with vitamin D and diabetes, let me know down in the comments. Now, when we look at the research for people with gestational diabetes, prediabetes, and type 2 diabetes, the findings are pretty encouraging. There was a meta-analysis by Wang and colleagues that looked at women with gestational diabetes who were taking vitamin D supplementation. And they found across 19 studies that vitamin D supplementation resulted in lower fasting glucose, fasting insulin, and it also improved insulin resistance. Now, in people with prediabetes, there was a separate meta-analysis that was published in 2020 that found that taking higher doses of vitamin D, this significantly lowered the chance of them developing type 2 diabetes. And then there was a third meta-analysis that focused only on people that had already developed type 2 diabetes, and they found that vitamin D supplementation in people that had a vitamin D deficiency and also had a BMI under 30, so not obese, the vitamin D supplements that resulted in lower A1C. In type 2 diabetes, when it comes to combining vitamin D supplementation with exercise across 10 studies, most of the studies found that this was a really powerful combination, and it was more effective in improving cardiometabolic risk factors than doing exercise on its own. Most of these studies found that combining exercise with vitamin D supplementation, there were greater improvements in insulin resistance, glycemic control, and blood lipids like LDL cholesterol, HDL cholesterol, and triglycerides compared to just exercising without vitamin D supplementation. Now, there was one study by Dadros that found that combining vitamin D with exercise, this had no effect on triglycerides, but exercising without vitamin D tended to improve the triglyceride levels, but the study also had a smaller sample size. Now, if a study doesn't have enough people enrolled in the study, so that means that the study was not sufficiently powered, then that means that there's not enough people in the study to demonstrate whether or not the intervention is effective or not. So we don't know. Now, when it came to whether combining vitamin D with exercise decreased inflammation, it was more of a mixed bag. There were 2 studies that found that combining vitamin D with exercise, it lowered some of the pro-inflammation markers like tumor necrosis factor alpha and interleukin 6. And one of the studies found that it also increased some of the anti-inflammation markers like interleukin 10. So that's great news. But one of the studies found that when you add whey protein to the mix of vitamin D and exercise, they found an increase in one of the pro-inflammation markers, tumor necrosis factor alpha, which isn't really a good thing, and the authors didn't have an explanation for this. So with only 2 studies looking at how vitamin D combined with exercise and type 2 diabetes impact inflammation, 2 studies isn't really enough to have any type of strong conclusions. It's exciting that vitamin D supplements may help with management of gestational diabetes, prediabetes, and type 2 diabetes, but it's important to keep in mind that supplements in general, including vitamin D supplements, they're not a replacement for other treatment strategies like diet, exercise, and medication. And it's important that if you're making any type of changes to your lifestyle, including taking supplements, you need to first discuss this with your doctor. Thank you for watching.